Hello, my name is Marijke Beltman and I am the final year coordinator of the clinical final year here in UCD in Dublin.
My name is Marie-Pauline Maurin and I'm an associate professor in small animal surgery here at UCD. I'm also a boarded surgeon specialist and working alone in the small animal hospital.
Clinical final year is the last year of the veterinary degree here, so it's clinical, which is on the hospital floor. You rotate through all the disciplines, so that is small animal medicine, small animal surgery, but also the accessory services like anesthesia, diagnostic imaging and clinical pathology, as well as large animal surgery, which is mainly equine, and farm animal clinical studies. So the clinical final year consists of 24 weeks based in the hospital here on campus and 3 weeks where students can choose their own area of specialism, and it has to have a specialist element to it.
So the teaching hospital here offers a lot of services for different animals. So we're there seeing horses, farm animal and small animal mainly. So on the surgery small animal side, we're offering different type of referral services, orthopedic surgery, soft tissue surgeries, any thoracic abdominal surgeries. So behind me you have one of the 3 theaters we have here in the hospital. We're also offering another services as well with oncology, dermatology, cardiology, and then all very specific internal medicine services.
So in the farm animal hospital, students get divided into groups and each groups have their own cases. So it's the student's responsibility to look after the cases and in conjunction with the clinicians and the interns and the residents, come up with a plan, a treatment plan, and then follow that plan to make sure that we have a good outcome for both the patient and the client. So students are involved in all the cases, both the workup but also small surgeries, and very much the same as in equine. There is first opinion cases, second opinion cases and third opinion cases. So first line but also referred in for a second opinion or third opinion or more advanced techniques. The 24 weeks here in the hospital, of those there's 4 weeks in equine and 5 weeks in farm. So 5 weeks in farm consist of 3 weeks in the autumn and 2 weeks in the spring, and that is to match the seasonal production system here in Ireland and making sure that students get exposed to the relevant type of caseload that you see in farm animal practice. In those 5 weeks, you'll spend time here in the hospital dealing with individual animals, but also out on our college farm, which is in Lyons in Newcastle, just outside Dublin, as well as on client farms for both routine work and investigations. The 4 weeks in equine are split up in 3 weeks here in the hospital, rotating between surgery, medicine and reproduction, and 1 week out on the road in the equine ambulatory clinic. Here in the hospital, we are a training hospital, so we're not only teaching veterinary students and veterinary nurses, but we have intern residents and then specialist clinicians. So the residents are following a specialist training program and will sit their board exams at the end of it. And basically the type of cases we get between us in equine is poor performance, lameness, medical colic, surgical colic, fractures. In farm animal, it's very similar, so orthopedic type of cases, but also abdominal, and especially during the more spring season, more production diseases such as displaced stomachs and retained fetal membranes and mastitis, management of those. So while the hospital here we get a lot of individual cases, sometimes we get one case that is representative of a herd health problem, which basically we use that case to work up that individual case, but also then to come up with a plan for the farmer from a herd health point of view. And we also get a lot of investigation and problem solving visits where we go down out to the farmer in the country and then investigate what is the cause of the problems that they are experiencing in the herd. UCD Lyons Farm, the college farm, which is out just on the Dublin border. We have the herd health hub there, which is basically our base for herd health related activity. There is a rotary parlour and 180 cow spring herd. There's horses, there's sheep, beef animals, as well as a few teaching pigs and teaching hens. So it's basically gives you a chance to be exposed to every type of animal and doing, again, both individual and herd health type of work. Students get to rotate through all the different disciplines and get exposed to all the different animals. So they come out with a very well-rounded, all-round degree that has covered all species and are basically ready for the veterinary world.